Hello. Today I would like to talk about why some people get breast implant illness and why others don't. That is the major question, the enigma of what we're trying to define, and I think once we can do that, it will be so much more helpful, not only with women with breast implants, but those contemplating implants. So I was wondering why this might be, why some women can get implants and do great for 10, 15, 20 years, and others get implants and within months to a few years start having the constellation of symptoms that we previously described. And as I was thinking about this, I got a synchronous email, and it described a test. It's a little cheek swab, so it's a genetic test that tests for the methylation detoxification pathway that happens in every single one of our cells. And Dr. Chris Kresser has a great podcast on this, talking about Methylation 101, in which he's speaking with one of his partners. And even though they're physicians, they speak in layman's terms, so it's very easy to understand. And Dr. Kresser suggests that this is so ubiquitous that the methylation detoxification cycle happens 1 billion times a second in our body, which makes sense. If we start to get toxicities in and we can't detoxify as efficiently as if our genes are at 100% capacity, then that might be able to build up over time. So I have started to test people for this and actually have a actual patient's results, and obviously her information and clinical data is all kind of blacked out there. But this cycle actually starts way down here with folic acid, comes through this lower cycle, up through the middle cycle, and then out to do a myriad of other things. So we test for 3 separate genes. The first is the MTHFR, then the MTR, and then up on the COMT. Now, MTHFR gets a lot of discussion these days simply because it's the gene that's the most studied. And we know that ladies that have issues with conceiving or carrying the pregnancy to term, a lot of miscarriages, the obstetricians will now test for the MTHFR. And if they come back positive, you can then offer a methylated form of vitamin B12 into the system, which greatly helps with the detoxification cycle. We also know that people with MTHFR tend to have more metabolic issues like possibly diabetes or future heart disease, and people with issues with COMT have more neurological issues. So by understanding this cycle, it gives us a better appreciation. Now, I can't tell patients and I can't tell you that this is the be-all end-all. This is a hunch I have, and those ladies with breast implant illness that have elected to get this study before their explantation have all come back very highly positive. And it seems that the more MTHFR and MTR, it tends to be a little bit more highly effective. Now, there is currently an ongoing study in the United States, and Dr. Patricia McGuire, a plastic surgeon, is heading this up. And I've spoken with her on several occasions on my thoughts with this. And I'll be anxious to see her data as she's doing all sorts of testing so we can try to unlock this mystery. As I said, there's no confirmational test. We can't do a blood test or a CT scan to say, yes, you have breast implant illness, or no, you don't. So this gets then back down to the fact that a lot of people say, well, these symptoms are self-reported, and that it's just the patient's perception. Well, their perception is their reality. And then they go on to say, the critics go on to say that, well, this just might be the placebo effect. Well, the placebo effect happens in about 30 to 35% of anything that we do, including prescription medications, surgeries, any intervention has a placebo effect. But what that tells me is that our mind has so much more control of our body than we ever thought could. On the flip side, there's the nocebo effect, where if you think you're going to have a negative outcome, and in clinical trials with medications, if they were told these are the potential side effects, at least 30 to 35% of the people have those side effects, even though they're getting a placebo or a sugar pill. Now, you might say that, well, these ladies know that that they have breast implants, so they bring these symptoms upon themselves. But I think that argument is negated in the fact that those symptoms come about before these ladies even understand or discover there's something called breast implant illness. So there's future data that we need to kind of look into. I'm continuing to research and sharing my information with others, but just we'll keep the lines of communication open. But those are just some of my thoughts on why some women can get implants and do well and others don't. Thank you.